There are 733 new cases reported from yesterday. All 733 were locally acquired. This brings us to a current active number of cases in the Victorian community of COVID of 7,160. Sadly, one person has died yesterday, and that was a woman in her 80s from the northern suburbs in Moreland. And can I take this opportunity of offering our deepest condolences for that family and the friends of that person. Our thoughts are with them at this very sad time. 84% of yesterday's cases were people aged under 50 years of age. This continues to be an overwhelming outbreak amongst both the unvaccinated and disproportionately younger Victorians. 297 people are currently in hospital with COVID-19. 66 of those people are in intensive care units, and 46 of those people are on ventilators. In regards to the cases that were hospitalised yesterday, 77% were not vaccinated, 19 were partially vaccinated, and 4% of people were fully vaccinated. There was a bit of a normal anomaly in that last number. You recall there's been an outbreak at the Meadow Heights Aged Care Centre as a number of people with large numbers of vaccinated residents. As a precautionary move, a number of those residents have been moved into a low acuity hospital setting. In regards to tests and vaccine numbers, Victorians saw 56,520 tests delivered yesterday, and through state-run clinics there were 41,029 vaccines delivered, and overall across all forms of vaccination sites in Victoria, 96,000 Victorians received a vaccination yesterday. 76.2% of the Victorian population over 16 years of age has now received a first dose, and 46.2% of Victorians have received their full double doses. Just wanted to take this as an opportunity to highlight that the state will now be moving into Moderna, an mRNA vaccination type, commencing next week. We are receiving 32,000 initial doses to administer through our state sites, essentially to make sure that the tremendous enthusiasm and delivery of vaccines through our pop-ups, which have been so popular in the north, the west and the southeast, and right across particular at-risk communities, that we do not lose the momentum for having started those pop-ups, that we keep going. So in that regard, we were very pleased to allocate from the Commonwealth 32,000 Moderna vaccines into the state-run clinics for the first time, and they will be delivered through our partners at Monash Health, particularly with the Palm Plaza pop-up in Dandenong, and if necessary, other arrangements in that busy southeast area where we've seen huge uptake in vaccines in recent days and weeks. Moderna is, of course, an mRNA vaccine and is both very safe and highly effective, and is available in Victoria predominantly through our community pharmacy partners to anyone aged from 12 to 59 years of age. Given some of the issues around Pfizer supply, particularly in the second half of October, we will be pivoting more of our pop-up sites in Moderna in the coming weeks, so as to ensure that that really strong drive of Victorians to get vaccinated in their communities in safe and accessible locations does not lose momentum. We're focusing our initial supply around that southeast area for Moderna because we have seen such a strong uptick. And our friends at Monash Health are also specifically trained in the delivery of Moderna in those pop-up sites. That Palm Plaza site in Dandenong has administered more than 6,200 vaccines in just its first week of operation in the heart of Dandenong. Moderna as an mRNA vaccine is being used across all states in Australia, and we welcome the addition of this particular vaccine into the toolkit of the state vaccine hubs as another opportunity for us to continually to ramp up our vaccine efforts. Of course, because most of the vaccines for Moderna are allocated to the community pharmacies, we would encourage anyone who is yet to get vaccinated to either book into the state-run clinics, book into the GPs and the primary healthcare networks, or book into the pharmacy network. The pharmacies will be receiving more than 300,000 doses of Moderna over the coming weeks, and those will be distributed across more than 700 pharmacy locations in the state, starting off, quite rightly, in those high demand and high outbreak areas of the north and the west of Melbourne and to the southeast. People can visit findapharmacy.com.au to find the nearest pharmacy that administers Moderna, or if you're over 60, AstraZeneca, and make a booking for that all-important first dose. In regards to the north, which continues to be the centre of the outbreak at the moment, we've seen a tremendous increase over the past week in the number of vaccines through our pop-ups, through the GPs, through the pharmacies and through the state-run clinics. And in some areas, particularly in the west and the north, we've seen the gap between the state average and the levels of vaccines being delivered in those communities narrow substantially. And indeed, in the city of Wyndham, we've seen the vaccine rate actually exceed the state average. So there is no shortage of enthusiasm for vaccinations in Victoria, and the key issue continues to be working with the Commonwealth to make sure we match supply and demand. In the north, we're also focusing this coming week in another substantial pop-up at the C.B. Smith Reserve in Fawkner, which will service a number of school communities on either side of that reserve and the wider community of Fawkner to make sure that the enthusiasm levels that we've seen for vaccines continues unabated. I'll hand over to the Chief Health Officer to give us more of a map of the outbreak, and then we're happy to take questions.